Hello, my name is David, and the joint I'll be focusing on today is a glenohumeral joint. This joint is commonly referred to as a shoulder joint. The head of the humerus connects to the glenoid fossa of the scapula, as you can see in this photo. So, being a synovial joint, both articular surfaces are covered with hyaline cartilage. The glenoid fossa is a shallow pear-shaped pit on the superolateral angle of the scapula, where the humerus head sits. As you can see, let me put this point real quick, right here. The glenohumeral joint is held by the glenohumeral ligaments. There's a superior, middle, and inferior. The superior glenohumeral ligament runs from the superior portion of the glenoid fossa to the anatomical neck of the humerus, and it prevents excess inferior translation or downward movement of the humeral joint, or the humerus head. It also provides resistance to external rotation when the arm is in inducted position. The middle glenohumeral ligament is located between the superior and inferior glenohumeral ligaments. It provides additional support to the anterior capsule. It primarily resists excessive external rotation of the humerus, particularly when the arm is abducted. The inferior glenohumeral ligament is a complex structure consisting of three bands. There's the anterior, posterior, and the auxiliary pouch. They all stabilize the joint differently. So the anterior band helps prevent excess anterior translation or forward movement of the humeral head, particularly in a position of abduction and external rotation. Posterior band, it helps prevent excess posterior translation or backwards movement of the humeral head, particularly in a position of adduction or internal rotation. And the axillary pouch, which provides stability in position of abduction or external rotation as well. So together, the inferior glenohumeral ligament complex plays a significant role in stabilizing the joint in various positions. And the other ligament is the coracohumeral ligament, which runs from the coracoid process of the scapula to the greater tubercle of the humerus, and it helps support and stabilize the joint by preventing excess superior translation, or upper movement of the humeral head. So the bursa is located beneath the acromion process of the scapula and above the rotator cuff tendons, and it helps reduce the friction during shoulder movement. The glenohumeral joint is a ball and socket joint that includes a complex dynamic articulation between the glenoid of the scapula, the proximal humerus, and it's functional. Functionally, the joint is considered a multi-axial joint, and the movements provided are there's flexion and extension, which are both in the sagittal plane, and they're both medial lateral axis. There's abduction and adduction, both in the frontal plane, which are anterior and posterior axis. There is internal and external rotation, which are both in the transverse plane, in the vertical axis. And there's horizontal adduction and horizontal abduction, which are both in the transverse place as well, and the vertical axis. And the last one is circumduction, which is the combination of flexion, extension, abduction, and adduction, and they all work together.